Local health leaders say rolling out vaccines is the answer to keeping their communities safe. But the pandemic has presented its own set of struggles that may make it harder to get vaccines to the public. And the logistics of getting so many vaccinated so quickly is proving difficult.
You know, we never have this problem with influenza vaccination, with pneumonia vaccination. You are trying to vaccinate a large amount of people in a very short amount of time. This is just a unique circumstance.
According to the governor's office, the state planned to receive 150,000 doses and get 150,000 Kansans their first shot by the end of December. But a New York Times report shows that Kansas is far behind in meeting this goal. Here's how the numbers break down. According to the report, the state's been allocated nearly 165,000 shots. So far, more than 114,000 of those doses have been distributed around the state. But only about 12,000 shots have actually been given out. That means only about 10% of the shots that have been distributed have been given, much lower than the state's neighbors like Missouri, which has given out about 31% of its distributed shots. Right now, Kansas is giving shots to high-risk healthcare workers and people living and working in nursing homes first. But you may see some differences county to county.
We broadened it out to all healthcare providers, and that includes in your nursing homes and your prisons and your EMTs. Every county may be doing it just a little bit differently.
The governor said the process follows the phases of priority outlined in the state's vaccine distribution plan. While things aren't moving quickly quite yet, medical experts do say they anticipate picking up speed as we move through the state's phases and it becomes available to the general public.
And once they're able to be distributed to those other places, such as pharmacies, commercial pharmacies, other small family medicine or internal medicine clinics, I think that will help improve.
In the meantime, medical experts and state officials are focused on controlling the spread of the virus through safety protocols like social distancing and practicing proper hygiene. As the year ends, some medical experts say that it could take years before the country is able to reach herd immunity, which would require vaccinating about 80% of the population. Kansas health leaders say it all depends on how quickly people are vaccinated. At the Capitol, I'm Rebecca Chung.